Here we've got an AP of the pelvis. This I'm not sure what it is, but it kind of looks like a quarter that might be on the bed. Moving on to the bones, taking a look at Shenton's line, or Shenton's arc. On the left side, it looks like this joint is congruent. On the right, it looks like the bottom of the femoral neck does not line up with Shenton's line, indicating that this is probably dislocated. Looking more closely at the right hip, you can see that the iliopectineal line looks intact. Ilioischial line also looks pretty good. Harder to see here, but the anterior wall looks intact, but the posterior wall does not. We're going to need some more films here, but first the patient has to avoid all this contrast out of their bladder from their CT angiogram. Then we'll get our Judet views to better see this fracture pattern. But if you imagine this patient was sitting in the front seat when they had a head-on collision. Their knee hit the dashboard, which axially loaded their femur, which then blew out to the posterior wall of their acetabulum as their hip dislocated posteriorly.